My name is Ian Kelly and I'm an orthopaedic surgeon working at UPMC Whitfield Hospital in Waterford. This video about total hip replacement is an educational video for my patients. Hip arthritis can be a very debilitating and painful problem, typically presenting with pain in the groin and thigh and occasionally pain in the knee. When hip arthritis is affecting your quality of life, despite trying all of the non-surgical treatments, you might consider having hip replacement surgery. The hip joint is a ball and socket joint, and hip arthritis is when the normal cartilage that lines the bone dissolves away, resulting in painful bone rubbing on bone, as seen on this X-ray. To perform a hip replacement, I make a cut across the bone in this area, and this enables you to remove the ball of the ball and socket joint. Then the socket is shaped to accommodate a metal socket, which has a special surface that bone grows onto. Into this metal socket, a plastic liner is inserted. Then, because you've cut across here, you can now access the center of the bone, which can be shaped up to accommodate a stem, which also has a special surface onto which bone can grow. You then put a head on the stem, and by putting these together, this is your new hip replacement. And that should take your pain away. Now, while 95% of hip replacements work very well, 5% or 1 in 20 patients can have a complication. The first complication is infection around the hip replacement, seen in approximately 1% of cases. If this happens, you may need to have the hip replacement removed and have multiple antibiotics. A second complication is dislocation, where the ball pops out of the socket. So we give you lots of education and advice before and after the operation. Another complication is a clot in the leg that could travel to the lung, which is always a concern with hip replacement surgery. So we get you out of bed and moving as soon as possible, and you go home on aspirin for 4 weeks to keep your blood thin. After the surgery, one leg could feel longer than the other, and if this causes you a problem, you may need to wear a heel raise on the opposite side. The sciatic nerve is also close to the operation and on occasions may not work properly after the surgery. And the final issue then is wear of the plastic liner. But over 90% of hip replacements still function well after 20 years. So if you're 70 having your hip replaced, 20 years later, when you're 90, there's a 90% chance that the hip replacement will be working fine. Thankfully, these complications are unusual and the majority of patients do very well. Everybody is seen in the pre-assessment unit to check their suitability for surgery and also in joint school for an educational session, because we know that the more you know about what's going to happen, the smoother your hip replacement will go. I hope you found that video useful. Thank you very much.